Hello, continuing from the last lecture, today we will look at the treatment of IBD. Let's take a closer look at the 5 types of IBD symptoms mentioned in the last lecture. The first is respiratory type. IBD patient with respiratory symptom has any type of rhinitis, such as allergic rhinitis or non-allergic rhinitis or seasonal rhinitis with runny nose. One of a proper formula for IBD with respiratory symptom is Sochungryong-tang, initial SCRt. Sochungryong-tang is Korean character and the next one is Chinese character. All traditional medicine doctors of Korea, China, and Japan think this formula as cure for rhinitis or cold. Korean medicine always try to approach from holistic perspective. So I try to assess not only IBD symptom but also general conditions. When I examine IBD patients, I make sure the patient has respiratory symptoms such as rhinitis. So, if the patient has both IBD and rhinitis, I primarily consider the formula for rhinitis such as Sochungryong-tang. Actually, among many formulas for rhinitis, I choose a proper formula which also could be used for diarrhea. Among them, best proper one is Sochungryong-tang. I described Sochungryong-tang to the IBD patients with respiratory symptoms. And I have confirmed that this formula is effective in remission induction. But you know, when I examine an IBD patient, I always check whether they have rhinitis. Then they always said, none of the Western medicine doctors have asked whether I have respiratory problems. So, if you meet an IBD patient, I recommended asking them if they have respiratory issues because there is a very high correlation between these two diseases. Sochungryong-tang consists of these 8 herbs. Before starting, you should know that a herb does not consist of one chemical. It is from nature and it is compound. A herb does not have one effectiveness. Normally, one herb has multiple effectiveness. Sometimes, one herb shows a different effect from a different formula. I'll show you the basic effectiveness of some herb today, but please keep in mind that this is not all that the herb have. First one, banha. It is effective for plum-related fluid, nausea, and vomiting. Left picture is a plant, right down is whole one, right up picture is cutted one. You should use a cutted one when we dispense a formula. Next one is mahwang. It is well-known ingredient of ephedrine. It is effective for asthma, cough, nasal discharge. Mahwang makes you sweat. And it has a side effect such as insomnia, losing appetite, and hardness of urination. If patient complain these symptoms like insomnia, I change the prescription herb from mahwang to bongryong. Next one is omija. The name of omija means 5-taste seed, but mainly it tastes sour. It is effective for cough, dull feeling in the head. Next one is kongang. Kongang is dried ginger. It's very important herb. It's used for the patients with yang deficiency of the spleen and stomach. It warms the stomach and intestines, and it treats vomit and diarrhea after eating cold food. If you have diarrhea after eating cold food, try some dried ginger. It will warm up your body. Next one is 세신. 세신 is used for accumulation of cold phlegm in the lung, dissipating external cold pathogen, and cough. This target is water dampness in the epigastrium. Water dampness in the epigastrium causes another problem like rhinitis and also can cause dyspepsia. Next one is 계지. 계지 is cinnamon. It treats dissipating external cold pathogen, warms the blood circulating, and upper body heat. It makes peripheral blood circulation better. Next one is 작약. 작약 treats muscle strain like cramp and blood deficiency by using blood-tonifying. You know, many parts of our body are made up of muscles. Your skeletal muscle, your stomach and intestine are made up of muscle. Even your blood vessels are also muscle. So, if you have a pain like skeletal muscle cramp, your abdominal pain from an intestine muscle cramp, or kind of ischemia by blood vessel cramp, this herb will help relieve pain. Last one is 감초. This efficacy of this herb is not easy to explain in words. Generally, it treats relieving spasm, contraction, or hypertonicity, and neutralizing the toxic property of poisons. But 감초 is used for many formula. It is difficult to determine its efficacy clearly. If an IBD patient has all signs of respiratory type, it's easy to decide to use the Sochungryong-tang. All signs of respiratory type are coldness, nasal discharge, cough, phlegm, dyspepsia, heartburn, abdominal pain, diarrhea. If the patient has all the signs, it's easy. If non-IBD patient has all these respiratory signs, Sochungryong-tang is the best formula. And in case of IBD patient, with some sign of this, not all, depending on how many, Sochungryong-tang might be the best formula. Even if IBD patient has just one symptom, like rhinitis, you could consider Sochungryong-tang. Let's look into some case studies together. Let's look at the first case. This patient came to my clinic on September 6th in 2017. He is 55 years old, male. Height is 168 centimeter, weight is 67 kilogram. He was diagnosed as UC in 2005 summer, and he has used mesalazine, sulfur, pentasa. These are 5 aminosalicylic acid, and anthocort. This one is steroid. At first, these Western medicines worked for him, but after March 2016, it started to lose effectiveness, and from February 2017, this medicine have no effect for him. Now, let's look at some symptoms that he had. He was very sensitive to cold, and his feet are always cold. If he had felt cold at his feet, he had to go to the bathroom with diarrhea with abdominal pain. So, he always had to put on foot warmers from 4 to 5 years ago. he had bloody mucosal diarrhea 7 to 10 times in a day. For 10 years, whenever seasons changed, he had rhinitis symptoms, including nasal discharge and cough, and no other sign. According to these symptoms, I prescribed Sochungryong-tang. The result was amazing. After taking Sochungryong-tang for 1 month, defecation frequency reduced 1 time per day, and he had no bloody mucosal stool. He could take off his feet warmer and become less sensitive to cold. After the 2nd month of treatment, nasal discharge and cough also disappeared. From March in 2018, he stopped taking Western medicine, and his body weight increased by 3 kilograms. Finally, in May 2018, inflammation was no longer observed on colonoscopy. Treatment ended. Let's see the colonoscopy picture. This is the picture before getting Herbal treatment. You can see bleeding mucous membranes. These are also the same. You can see bleeding mucous membranes. Let's see colonoscopy picture after getting Herbal treatment. No bleeding mucous membrane. He maintains remission till now. Next type is water dampness type. This type has any sign or symptoms induced by excess fluid in the body, such as dizziness, edema, frequent urination, inhibited urination, and or feeling of residual urine. Some of proper formula for IBD with water dampness type is 오령산. San means powder. But I said before, powder is uncomfortable to take. So make it tang, liquid medicine. If the IBD patient has edema, frequent urination, more than 8 times a day, and has feeling of residual urine, maybe he could be this water dampness type. Check this. These are 5 herbs that makes up 오령산. One is taxa. Taxa is rhizome of this plant. Taxa treats internal retention of dampness by using diuretics. And it also treats dizziness. Let's see the next herb. This is jeoryong. It is part of mushroom. Jeoryong is used for thirsty and disorder of urine. Disorder of urine means having too much urination during the daytime, normally over 7 to 8 times, or feeling residual urine. Next herb is chul. Chul is the root of this. There are changchul and baekchul. Actually, they are the same, so don't think about it. Chul eliminates dampness for invigorating the spleen, so this herb is effective for increased urination frequency, feeling residual urine, and swelling. Next thing is Byunghee. Byunghee is mushroom sclerotium. Byunghee treats internal retention of dampness by using diuretics and calming the nerves. Last herb in 오령산 is geji. Geji is cinnamon. We went over this before, so we will skip over to the next topic. Maybe you can notice For herbal Oryongsan are concerned with urination. Oryongsans excrete excess water in your body in the urine. Symptoms of water dampness type are swelling, frequent urination, more than 8 times during daytime, night urination, feeling residual urine, and Oryongsan has effectiveness on the treatment of nausea, vomit, car sickness, light dyspepsia, and urticaria. Let's talk about night urination. If old people, maybe over 60 or 70, have night urination, it's not a big problem. It could happen. But the younger one has urine at the night frequently. It's not normal. You should notice that. If the IBD patient has oral water dampness symptoms, it's also easy to decide the proper formula. But it's hard if they have less these symptoms. Anyway, if they have just one of these signs, you should consider Oryongsan. Let's see the second case. This patient came to my clinic on May 25th in 2013. She was 37 years old, female, and was diagnosed as UC in May 2009. At first, symptoms got better with taking steroid, but side effects occurred, so she stopped using Western drugs after 2012. Let's see her symptoms. She was a little bit sensitive to cold, and she also had a little bit of cold hand and feet. She always had severe fatigue and swelling in the morning, and sometimes she had light palpitation, dizziness, nausea, and vomit. She had abdominal pain 2 to 4 times a day, diarrhea 2 to 4 times in a day, bloody mucosal diarrhea, and no other sign like rhinitis. These symptoms, palpitation, dizziness, fatigue, and swelling, are all signs of water dampness. So, I classified her into water dampness type. So I described Oryongsan according to this type. After taking Oryongsan for 9 months, the symptoms such as palpitation, dizziness, fatigue, nausea, vomiting, and swelling was eliminated. Abdominal pain was also disappeared. Defecation frequency reduced 1 time in a day. No bloody mucosal diarrhea. Gained 3 kilograms. Let's see the colonoscopy picture before she took her formula. You can see blood and loss of vascular markings. You can see loss of vascular markings and erythema. Same one, loss of vascular marking, erythema. This is the colonoscopy after taking Oryongsan for 9 months. You can see vascular clearly and no erythema, no edematous mucosa, and bleeding. Yes, it looks very clear. Let's move to the next type. Next type is upper gastrointestinal tract type. The IBD patient with this type has abdominal pain, dyspepsia, and/or gastric stiffness. Reduced appetite or reduced total amount of meal. Main proper formula is panasasimtang. In general, it is taken for granted that patient with IBD has indigestion, but there are some patients without indigestion. But many IBD patients have a problem with digestion, so this type accounts for a large proportion of IBD. 7 herbs included in panasasimtang. This formula tastes very bitter. Let's see the herb in panasasimtang. First thing, panha. We explained it before. Panha is known as having toxic ingredients, but after boiling with water, it's disappear. So don't worry about it. Next one is 황금. 황금 is the root of this herb. Letter of 황 means yellow. It relieves accumulation of dampness heat. It also treats dyspepsia and diarrhea. This is 건강. We also explained it. It warms your inside, so it can stop your diarrhea, which is caused by cold food. Next herb is 인삼. 인삼 is ginseng. It's a very famous herb. Insam's origin is Korea. It has therapeutic method of using potent tonifying medicinals. It helps digestion and is used for tiredness. Every Korean knows it and use it often. Next herb is 감초. I explained it before, so let's move on to the next topic. This is 대조. 대조 is jujube, and you know what it is. Upper picture is jujube tree, under is dried jujube. 대조 relieves muscle tension. Last one is 황미연. It is rhizome. Do you remember that 황 means yellow? Yes, its color is yellow, and it tastes very bitter. If there are liquid medicine which contains 황미연, it tastes bitter. It is removing pathogenic fire by using bitter cold medicinals. So it treats palpitation and anxiety. Let's see the symptom of upper GI tract type. The signs of upper GI tract type are nausea, vomiting, dyspepsia, especially depend on the amount of food, stiffness of epigastrium, abdominal pain, especially after meals, reduced appetite, diarrhea after eating cold food and spicy food. If an IBD patient has all these symptoms, panasasimtang will surprise you. Sometimes the IBD patient has few symptoms, and in particular, they do not complain nausea and vomiting. At least, if the patient has only one, dyspepsia, without any other symptoms, panasasimtang might be the proper formula. Even if the non-IBD patient has dyspepsia, you can use panasasimtang. Let's see next case study, which was published in 2019. The patient came to my clinic in May 2016. She was 34 years old, female. She was diagnosed as ulcerative colitis in January 2016. For 2 months, she took Sorondo, folic acid, Asacol, etc. Let's see what her symptoms were. She complained dyspepsia, GERD, and she had nausea when she had dyspepsia. She had acid reflux and cold abdomen. She had diarrhea 2 to 3 times in a day with blood and mucus, and no other sign, like rhinitis or swelling. After she took Banasasimtang for 5 months, she had normal defecation 1-2 times in a day. Dyspepsia, GERD, nausea, acid reflux, and cold abdomen were all disappeared. After November 2016, she stopped using every Western medicine. Let's see the colonoscopy before taking Banasasimtang. You can find bleeding, edematous mucosa, loss of vascular markings, erosions. Next picture is the colonoscopy after taking Banasasimtang. You can see clear vascular marking and no bleeding and erosions. Okay, we review the first 3 types. Let's take a short break and pick up on the 4th types.